Hello, everybody. Good morning. Good morning to each and every one of you. Dr. Amar, or he prefers to be referred to as Amar, is a very accomplished physician, served in the civil service for more than 35 years, and was formerly head of the Pediatric department at Ipoh Hospital, and also, the head of the Clinical Research Center at Perak, Malaysia. Now, Amar has a really big heart and a long-standing interest in children, in the community, disability as well, family, self-help groups, NGOs, child abuse, adolescents, and disadvantaged and even marginalized children, especially the orang asli. So here we have a very special man. He's an active child advocate and is the recipient of the Outstanding Asian Pediatrician Award in 2012 and the Senior Advocacy Award in 2016. He brought in, I think he and his team brought in the MMR and also the HIP vaccine into Malaysia. And I have attended several of his talks and always find that it has always been informative and the data he presents are always very helpful. So Dr. Amar, thank you for carving the time out to be with us this morning. And we appreciate you coming in. And also this morning, we have our very own Dr. Ng Yi Ki. She will be moderating this morning, whom we unanimously voted and appointed as moderator. She's a medical doctor as well as specializing in general pediatrics and is currently practicing at Baby and Beyond Child Specialist Clinic. So this morning, without further delay, may I pass the time over to Dr. Yi Ki, who will take us through some housekeepings. All right. Have a good session, everyone.
Hello, good morning, everyone. Could you give me a thumbs up sign if you can hear me well? Yeah, I'm not muted, right? Good, wonderful. A very good morning to everyone here in Zoom, as well as the viewers that are on the Parent Tribe Facebook Live right now. Hello, guys. Good morning. Thank you for spending your precious public holiday morning with us. My name is Yi Ki, and I will be your host and moderator for today's talk. It's really amazing because in one day, the number of registrations went over our capacity in Zoom. And so due to overwhelming response, we decided to take this Parent Hangout session live to Parent Tribe Facebook page. And we're so glad you're able to join us. Parent Tribe is our social media platform where we share stories, tips, and conversations on marriage and parenting. We also hold various online events as well for the community. So, we do follow this Facebook handle to get the news and notifications of the events coming up. All right. I'm so eager to pass the mic to our esteemed speaker today. But just spare me just a minute, and let me go through some housekeeping rules, yeah? Firstly, we want to thank you to all the registered participants for the questions that you have included during your registration. Many of the questions will be covered during the talk. And for the participants in Zoom, if you have any other added questions, feel free to type them in the chat box as the unmute option is not enabled during this event. So similarly, for those viewing in Facebook, please feel free to type your questions in the comments. There will be the team that will collect and collate all the questions for the FAQ sessions, which we will have after Amar's talk. We will try, we expect we might run over time, but we will try to field as many questions as we possibly can. Next, this session is recorded, so please note that after the live event, the recording may be taken off Facebook for a while to be edited before being reposted back to Facebook. So don't worry if you see it missing for a while. You can come back another time to watch the replay. It will be posted. Okay. Finally, there will be notes, really, really good notes that's prepared by Amar himself to be emailed to registered participants after the event. So for our friends, if you're viewing from Facebook Live and you haven't registered, registration is still open until 12 noon today. I believe that one of our team members is putting the link in the comment section in Facebook right now. And so please please register if you'd like to have those notes. Do give us a couple of days, to email it to you. It will not be immediate. Okay, now having said all that in proper place, it is my real privilege to introduce the speaker for today. I think I can only call him by this salutation once, because I have been warned that I am liable to a hefty fine should I do it one too many times. And Tiffany has really introduced the speaker well, and that's Dr. Amar. And he's done so many great things for the pediatric community, as well as the communities beyond that, and I just like to add that he is married to a beautiful lady, and that's Dr. Lim Swee Im, and I believe she is with us on the Zoom platform right now. Hello, Dr. Swee Im. And some of you may not know, and I think this is a little treat for everyone here, but Amar is an avid bird watcher, and you can actually see some of his offerings on the Oriental Bird Club image database online, and it's beautiful, Amar. The pictures are so beautiful. I saw the ones about the woodpeckers. Beautiful.
Thank you.
So, without further ado, please join me to warmly welcome Amar with your Zoom emojis, your hearts, your claps, everything.
Thank you, Iki, for that kind introduction. And Tiffany, thank you for reaching out and organizing this and asking me to do it. Not that I enjoy talking so much, but I think that the need is there for this particular issue right now. I'm not sure how all of you are this morning. It's been a tough period for me, and I think tough period for the country as a whole. Let me share a screen and just show where we're going today. All right. So I'm going to be talking about children and the impact of COVID-19 and vaccination. I'm going to cover a couple of areas. I thought just before that, let me show you my morning. This was my morning. It's a sunrise taken from the roof of our house. By the way, my wife says hi to all of you. And, we see lots of beautiful sunrises, gives us a lot of hope. And I think in this time, it's very important not to look just at COVID numbers, not just look at the government or what we're doing, but to look very strongly at God in these times. I think, don't depend on me this morning, depend on God. I think that's the important thing. I'd like to share you a small thing that I often share with young doctors, but I think perhaps good to share with all of us is I often share with young doctors that, three aspects of God's love. And sometimes I call it three loves, but actually it's one love in three different ways. And the first one I like to say is God's love for us is very personal. Sometimes we think, oh, God loves the world. Yeah, he does, but he loves each one of us personally, intimately, each one of us. And we need to know that love as an individual. The second love that I know from God is that God is unconditional in his love. He gives his love freely to us, already given. So it's a choice for us whether we would like to receive this love or not. We can't earn it. There's no way you can earn God's love, contrary to the way some people talk about it. But you have an opportunity to receive it, and there's no limit to how much you can receive. It's freely given. And the third love is that God's love is everlasting. It's forever and ever. And I like that one very much. It's like a fairy tale, and I'm very much into reading fantasy, and it's like the Cinderella Sleeping Beauty story, and they live happily ever after. And that's God's love for us, that it is always there, with us forever. I'd like you this morning to just reflect on that as we deal with this difficult area for our children. As mentioned by Tiffany and Yiki, there are going to be notes, okay? And I've got a bit.ly link to the files and a QR code if you want to scan. The QR code is going to be the next two slides as well, if you like, but they will email the notes to you. And the first two notes are the most important, which is a child vaccination fact sheet, which I've updated for you. In case you don't catch all that I say this morning, much of it is going to be here, in fact, more perhaps. And secondly, I decided to write something about getting our children back to school safely, because this is a concern for many parents, especially with the announcement to get school back by September. But I've been writing quite a bit, and I like to share with you how to keep safe in the face of the worsening pandemic. The file is there. Building a resilient family, because many people are talking about how they should not trapped and are struggling, and that gives you 10 ideas how to restructure your family and support your child. I put in 2 Ministry of Health guidelines, which I think are very critical and the public should have. I think a lot of people ask me questions, but the answers can be found in here. One is the guideline on pregnancy and breastfeeding, which is relevant today because we're dealing with children. Another one is the guidelines on vaccination. This is the updated guidelines. And inside there, they discuss a lot of issues. Have you got this condition, that disease? Can you be vaccinated or not? A lot of those answers can. And you can't read these guidelines, but you might just want to search for a keyword and look for the area that you're interested in. And finally, something that I wrote with a couple of friends this last week, talking about how we as a country can come out of this crisis, is an emergency action plan. I offer that to you because I think we should advocate as a public for our government and the Ministry of Health to actually put into place changes and not continue the way we are. All right. So I want to say there's some important caveats to what I'm going to say today. Things change very quickly with COVID-19. Last year, no vaccine. This year, got vaccine. And how the vaccine works is also changing. New vaccines are appearing. So it's very voluminous. And thank God we belong to a lot of doctors groups which offers ideas. And I'm always very grateful to the National Doctors Group which supports us. And I want to talk today based on the data and the science, because medical opinions may vary. A lot of you listen to all the WhatsApp opinion. I think be careful about that. Ask what is the basis behind this opinion. If somebody gives you a video or thing, ask for what's the science behind it, the data behind it, before you recirculate it as well. And finally, recognize that our data transparency is limited in our country. So I can't tell you all that is there because I don't have all the data with me. Okay, so this is what I plan to cover. We must discuss a little bit what's happening in Malaysia because this influences whether we should vaccinate children or not. I'm going to talk about how severe COVID is in children in Malaysia and in the world. Then we'll talk about whether COVID vaccines are safe to use in children. Then should we vaccinate our children? It's a risk-benefit thinking. How to get children back to school? Very briefly, because I'm going to give you a document. I'll just cover the key points and may not be able to cover supporting children, but I'm going to give one tip about that. So let's come to the first one. So this is the situation that we are in Malaysia right now. We have an uncontrolled outbreak where testing is very limited, so we don't know who is infected. Clusters are not our focus. The health service is overrun in some states. Deaths are rising. Young persons are more affected now than last year. Mutations are spreading. And thank God, we have one good hope there, which is our vaccination is accelerating in the country. So this is what Malaysia looks like. This is a 7-day average data. You can get this from this lovely group, Our World in Data. You can generate your own data there. They keep all the data they can find on all countries, including Malaysia, and you can see that we were pretty good until the end of last year, and then we've spiked, and now we're actually going very, very high right now, have not settled at all. And if you compare us with other countries, I've just chosen a few countries, you can see that per million people, this is rate per million, we've done even worse in India right now. And of course, Indonesia and Thailand also picking up. Again, all depends on numbers, and you can argue those countries don't test much, but I don't think we test much either as well. So there is a data gap in all these countries, including ours, but telling you that we are actually in a bad place. Here's data just looking at numbers. It took 1 year to reach 100,000, and now it takes only 9 days to reach 100,000. Can you measure the impact of that difference? From 1 year to get 100,000 positive cases, now we take only 9 days. But again, remember, these are just the ones we test for. A lot are missing. How do we know they're missing? Because this looks at our testing numbers, the blue bars, and the red bar looks at the test positivity, which you can see is creeping up all the time. WHO recommends this red line below 5% test positivity, but we are actually, yesterday we reached 10% plus. That tells you that we're missing a lot. For every one we pick up, there maybe 3, 4, 5 out there that we don't pick up spread. And so that's why we talk about community spread right now. The blue bars down there are the ones who are found from a cluster, found from a factory or a workplace. The orange bars are the ones found from community. So these are not having their contacts traced most of the time. So every one of these that is found, they maybe have 5, 7 other people who are infected behind them, but we don't know who they are. And that's a number that you should look at. So we have a roaring epidemic, especially in the Klang Valley, but also happening in Negeri Sembilan, Melaka, Labuan, and other parts of the country. I'm worried that we are going to pick up as well. I think it's starting to pick up in Johor and other places. So as our Director General of Health has said, and other people have said, our health system is collapsing in many places. Some people say it's collapsed already, but I think people are trying to cope in casualty and in the wards and even in the quarantine centers where respiratory support is being given. And the problem comes when you have an overrun health service is that we have to make very difficult decisions. Who do we ventilate, who we don't ventilate? So, the older you are, the less likely you are to get significant ICU support. The younger you are, the more likely to get. We also have no data on other people who are dying because they can't get intensive care support. They don't have COVID, but they've got another condition that needs ICU support, but they can't get it because, of the limited ICU space right now. So what's happening recently? This is looking from June to 18 July, and these are our daily deaths, the bars in blue, okay? And you can see that in June, we had 3.3 deaths per hour. In July, we have 4.3 COVID deaths per hour. That's not a good sign, we're going up. Even worse is this red line here. This is the percentage of deaths brought in dead. That means they didn't reach a hospital. They died before they got to a hospital or health facility. And you can see in June, it was 10%, now it's 13%. And I feel for these people either didn't know they were infected, didn't know they were ill, couldn't get the support they needed. We need to find out why, and not all of them are old people, some of them are young people as well. So imagine that of our deaths, about 13% of them this month alone are dying before they can reach us. Okay, and that doesn't argue well for our services. So a summary of what I've been saying, but I want to come down here. Notice that almost 16% of people who died had no chronic illnesses. They're healthy people. Notice that 33% are under 60, even some of them under 20, and that almost, almost half our deaths just occurred in June alone. All our deaths in the country. So we also have no data on people who die after leaving the hospital. Overseas, I've seen rates of between 6 and 10%, sometimes higher, of people who die with COVID after leaving the hospital. They left the ICU, but they still continue to die because their lungs and hearts are damaged out there. Okay. So this is the kind of thing that worries all of us and should worry you. The X-ray on the right here is of a normal individual. The one on the left here of the young 29-year-old person who had COVID in our country. You can see the bad, nasty pneumonia this person had and then died very soon, 1 or 2 days after this X-ray was taken. And this is a young, healthy individual getting COVID. So COVID doesn't just attack our lungs, it attacks our brain, it attacks our vascular system, our blood vessels. So the vascular system in the brain, the lungs, and other organs as well. Some of the reason this is happening is because we have mutations, and we know that the Delta mutation is spreading. Unfortunately, we don't have enough samples or testing of this to let you know. In most countries where Delta has come in, it has taken over the entire outbreak. It spreads very quickly. For example, here you can see data down here just from July 13 in Kuching, that 16 more cases of Delta spreading very rapidly in the Kuching area right now. But I wouldn't be surprised if it's spreading rapidly in the whole country if we had enough testing to show it. And Delta is 60% more transmissible than Alpha, and Alpha is 50% more contagious than the original. I don't know whether you can appreciate that. It's very, very high. So the original, maybe if one person gets infected, might infect 2 or 3. With Delta, one person infected may infect 5 to 7 individuals. And a lot of virus comes out because of the Delta variant. So the viral load, the transmission of the virus is a lot. So it's becoming the dominant strain. Is it more severe? The data is unclear about this. Because it infects more people get sick. Because the viral load is extensive, a lot younger people get sick. Is it resistant to vaccines? A lot of people are asking. This is the latest summary data. Definitely, you can get infected despite having your vaccines, but the safety profile for hospitalization, that still seems to be good for Pfizer, for Moderna, AstraZeneca. Not enough data for J&J, almost no data for Sinovac, very little for CoronaVac or the other vaccines. Okay, so right now it does seem that for AstraZeneca and Pfizer, the Delta variant doesn't kill you or hospitalize you, but you still might get infected, which means you might give it to somebody else. Okay, I think we need more data for Sinovac, and there's some data from Indonesia and Thailand that's frightening people, but I would argue that data is not as clear as it looks. Don't judge that just from the surface. We need the hard data to be sure how protective this vaccine is. Okay, so good thing we're vaccinating. We were slow to start there. Took a long time to reach 1 million people, but now we're going very, very fast. And currently we vaccinate 1 million new people. I'm talking with the first dose only every 4 to 5 days. And I think this is going to be accelerated to almost every 2 days. So we're going to be doing, probably 400 to 500,000 vaccinations a day for the next couple of weeks. So currently we reached 30% with 1 dose and almost 14% with 2 doses. This is very important because with the Delta strain, we know that 1 dose of Pfizer AstraZeneca is not adequate. We need 2 doses. With all the vaccines, 2 doses is what we need. Here's comparing us with other countries. Here's the the partially and the fully vaccinated. This is taken at July 16. And of course, our neighbor has done well, but it's estimated in about 3 months, we'll probably come up to 75% of our population vaccinated. But again, recognize that this is a projection. I think it will start to halt a little bit as we come to vaccine-resistant people and more difficult groups to vaccinate. It has happened in every country that they are vaccinating this, using the vaccine. Okay. I want to argue that our vaccine rollout is not equitable. We're pushing a lot of vaccine to the hot zones right now, the Klang Valley, Negeri Sembilan, Labuan, and Sarawak for political reasons possibly. And that's our national average, which looks good. But a lot of states are below our national average because they don't have adequate vaccine supply. So once these states get mopped up, then a lot more vaccine will then come to other states. But I hope at this point, we must work very hard not to allow Delta to spread widely in the other states. Otherwise, we have the potential to end up just like the Klang Valley. Okay, so that's telling you our situation. We are still in a very dire place. We hope to come out of it. And we cannot just rely on vaccinations. We must rely on more than just vaccinations, tests, and us keeping ourselves safe. So what about COVID and children? As a summary, there's growing numbers of children infected, but mortality is still small. Long COVID is the thing you should look at and look for more data. I must say this numbers of children is not really very real because children usually don't show much symptoms. Nobody tests them. So, whatever data we show you is very limited data. So here's data released from Ministry of Health from last year to May, where they show 8 to 2,000 children were infected, the majority in 2021. Here's the latest one showing 100,000 plus children, which is up to June data. I'm coming back to this one because this was given some breakdown. There were 15 deaths inside here. In comparison, there were more than 2,000 adult deaths. So a very small number of deaths. But to me and to you as a parent, any child death is devastating for us. Okay, and you can see the deaths were in the smaller kids and the bigger kids. There's the two sort of groups that had a slightly increased deaths compared to the in-between group. Again, it could just be how we skewed our data and how much we found. Again, I suspect that this is small. This one actually is probably a lot more children infected than the ones that we know. The deaths, of course, are easier to find out. So what's happening internationally with them? Again, the mortality is small internationally, but long COVID is the one they're worried about. Here's one international study looking at 7 countries and mortality. The problem with this data is they base the data on the population, not infected numbers. So they said 1.7 out of a million children die, based on population, not on infected, which I think is a bit of a limitation looking at it. And comparing in Malaysia, it was 1 of 2 out of 1 million children. But if I change that numbers based on those infected, here's a number you should remember for today's presentation. For our data at present moment, for every 1 million children who get infected in Malaysia, 182 will die. That doesn't sound so good. Huh? Again, this data is limited because we don't really know how many children infected. It's probably half this, or maybe even 1/3 of this, because there's a whole volume of children out there that got infected. Only a small number we knew were tested and then some died. Huh? So probably it's a lot lower than this. But if you look at comparison with adults, there's no comparison. The adult death rate is very, very large compared to children without it. And of course, if I take the older adult rate, this number will go very, very high. Okay, if you're past 80, I think your mortality is extremely high, probably 1 in 10 at least. So what kills children or what makes them very sick? There's this disease which is used to be called a Kawasaki-like disease, a disease that Iki and I are familiar with. It's now called a multi-system inflammatory disease, sort of like your vascular system overreacts, damages many vascular systems, including your heart, your skin, your brain, other places. And you can see in the US, up to about June 2nd, they had thousands of cases of these and a couple of deaths. So this is one thing that kills children, okay? And something that we need to look out for. Not very common, but something to be worried about. But this is the one that we really need good data, and data is slowly starting to emerge. This is long COVID. And I find that many Malaysians don't read enough about long COVID or think enough. Please read it both for adults and for children. For adults, long COVID is estimated as 10% of children. What does it really mean? Long COVID means that after you clear the COVID infection, you still get tired, you still got a headache, you're difficult concentrating, you have sleep problems, you have difficulty going back to school, or as an adult, difficulty going back to work. And some people, their lungs and heart are damaged such that they can't actually walk or jog or do things that they could do before. And it lasts beyond 5 to 6 weeks. For some people, it lasts for months, okay? And UK's got some of the best data for this. and they quote high figures for it. Russia quoted 25% after discharge from hospital for children. Okay, the latest UK study fortunately showed a much lower rate. This is a community-based study, showed only about 1.6%. For Malaysia, we have no data, but for adults, for those admitted to ICU, 60% after discharge had long COVID. But I want to tell you that long COVID doesn't really respect your admission. It can happen to someone who had a mild infection or even no symptoms at all, you can still get long COVID. So this is the biggest problem with long COVID. As doctors, this is the one that we worry about. That's the one I worry about in children. If enough children get infected, then long COVID is going to be nasty. And the figure I'd like you to remember right now, this is probably the ballpark figure we're thinking right now. Between 1 to 10% of children are going to get infected with long COVID. We don't really know the real answer there. I hope it's on the lower end. And I hope it's not even 1%, but I'm a realistic person and we have to face the reality of this. Okay. So the next question that you're going to ask, is it safe to use vaccines in children? Currently, the vaccine trials appear safe and effective in children. They work and they appear safe, but how common really are severe rare side effects? That we are not really certain with. So like AstraZeneca, Pfizer all look safe in adults when they first came out, but when we start using in millions of people, then we start to see the Pfizer myocarditis, the heart inflammation, the AstraZeneca bleed in the brain. Those only happen when you start using in millions of people. The same is going to happen with children. Okay. So currently there's emerging data only for these two, Pfizer and Moderna, which are both mRNA vaccines about risk of myocarditis in children. Let me share the data with you. So currently from the vaccine trials, Pfizer is good for teenagers. Sinovac, we've seen a lot of media reports that is good for 3 down to 3 tested in clinical studies up to 3 to 17, but I haven't seen the published data. I would love to see the published data on this. Okay, so right now, a lot of media reports. AstraZeneca, they're doing trials in 6 to 17 years of age, but no data yet. And of course, people are doing many vaccine trials down even to 6 months, which sometimes I get very nervous with. I'm not sure I want to go down to that age in vaccine trials just yet. Okay, so all these are in progress and you'll get some idea. But bear in mind what I said, you know, the severe side effects, the rare ones, we won't know from these trials. We only know the common side effects and how effective the vaccine. So currently, the vaccines look good. In fact, the Sinovac study in children suggested the antibody response is even better than in adults. Okay. So all vaccines have rare side effects, even the ones we're currently using, whether it's measles, mumps, rubella, diphtheria, tetanus, pertussis, whatever. They're always rare side effects. Okay. And the commonest, I wouldn't say commonest, the one that we know about is the allergic reaction. Now we can get allergies from anything. We can get allergies from food. We can get allergies from, you know, from other drugs, but we can get allergies from vaccines. Okay, so this is the ballpark figure you should remember. So 100,000 adults or children is going to get an allergic response to vaccines. Some of them we will know. If your child has previous allergies, egg allergy or some other form of allergy, I think we need to be a little bit more cautious with you. I think at this time, for adults, of course, if you've got multiple drug allergies, we're giving the vaccine to you in hospital. As a child, if you had if a child has previous allergy to vaccines or previous multiple allergies to food or to drugs, I think this child should not receive a vaccine in a community center, should be in hospital. Okay, so this kind of guidance has not come out yet, but it will come out for Malaysia once we make a decision by vaccinating children if we decide to do that. Okay. So what about Pfizer and Moderna and the myocarditis? Here's the data from CDC. They have a very good reporting system for adverse events. And you can see down here the table, as the age becomes younger, and look at second dose, this is per million doses, the risk of getting a myocarditis is higher and higher. This is per million, 37 per million once you come down there. Okay, so this is inflammation of the heart due to the Pfizer or Moderna vaccine. And the highest risk is for the second dose 4 days after the vaccination in boys under the age of 30. That's the highest risk right now. Okay? Currently, the latest figure, not from this data, but from the latest figure from the vaccine authority for children in the US says 1 in 20,000 second dose for 12 to 17 years of age. And that's a figure you want to remember for Pfizer myocarditis. You can remember any figure, 1 in 20,000 children age 12 to 17 will get a myocarditis. Okay, what happens to most of them? Well, many of them get admitted to hospital, some get admitted to, a few get admitted to ICU. So far, nobody has died there and everybody's been discharged. But we have this data from Israel, which shows a much higher rate of myocarditis in young individuals, okay? 4 to 5 times that I've just quoted to you, and they have had a couple of deaths, very few deaths. US has had 1 death, but they're still investigating, so I cannot confirm that this is a death happening this year. So it's possible. My wife and I always talk, what will happen to these children down the road with this myocarditis? Okay, they recovered, but will they have problem with their heart function later? Nobody can give you an answer to this question at the present moment, but it's something to remember at the back of our mind. AstraZeneca, nobody can answer. Will they cause blood clots? J&J as well. Will they cause blood clots in the brain? Nobody can answer. Sinovac, we haven't seen enough data about rare side effects for me to give you an answer about this. I wish we had a good database about the rare side effects of Sinovac. But it's one of the old-fashioned vaccines, so probably a lot more anaphylaxis than anything else that's going to happen there. So our National Pharmaceutical Regulatory, which is very, very strict, has approved Pfizer vaccine for 12 to 17. Has approved for use, but we have not using yet. Parents can register their children on MySujatra, but there's no push to give. Some parents who actually got an appointment for the children who went, but they were told no, they cancel their appointment, and went home. Okay. So what I think we need is a very vigilant surveillance on vaccine safety signals. We must share this data with all parents, and we must act early. Otherwise, when safety signals start to appear, like has appeared in the US for Pfizer and Israel, thank God they reported it very early, and that alerted the rest of us. And we will need this in our country as well, okay? So should we vaccinate children because they benefit the family and society? Definitely, if you vaccinate children, you actually reduce COVID transmission in the community. We can get back to, sort of what we talked about, herd immunity. Although some people say don't talk about it so much, but, to reduce transmission, maybe that's the word we should use. Of course, there's one other issue. We need to stop new mutations. If we don't vaccinate children, then new mutations can continue to appear, and some mutations may not respond anymore to vaccines, and we'll have back a new cycle of infections in vaccinated adults. But we must also argue that all adults must be vaccinated first, and there are a lot of vulnerable adults who have not been vaccinated yet in Malaysia. We shouldn't do children until we do adults fully, because adults are more likely to die. Adults are the ones who mix more socially and go to work and stuff like that. And of course, some people argue that we should also vaccinate poorer nations first. Why poorer nations? You say, okay, let me Malaysia first. And some countries are behaving like this. But let me tell you that if we don't vaccinate Africa, like for example, Africa, I think it's only about 3% vaccinated. Again, they're going to be a breeding place for mutations. And those mutations will come back and hit us. We're no longer an island. No country can live alone. Okay, so that. So children rarely have severe illness. Adults have severe illness from COVID, we know. But we know children can spread COVID to adults. They are recognized as a source of transmission within households to other family members. And if we don't vaccinate children, we then leave our schools as a place for COVID outbreaks. Has been happening in other countries, okay? Because there is no immunity in school at all. The teachers may vaccinate, but there's a whole bunch of children. 95% of people in school are children without vaccination. So we can spread quite easily in that environment. So what is herd immunity? Some people are asking. I wrote an article about that in the press some time back, but on the left here, in a place where very few people are vaccinated, the dark circle are very few people vaccinated, the orange red circle are the ones who are infected, and the white ones who are not infected. And so the virus can spread because not enough infected people. But once you come to the diagram on the right, where enough people are vaccinated, then the people who are infected can't spread this so easily. Having said this, you must bear in mind Delta. Delta can cause an infection in these people who are vaccinated. May not get ill, but they might be able to spread it, which is why whether you're vaccinated or not, you need to maintain your mask. You need to maintain your social distancing, your SOP, not time to go back and have a party or even a birthday party for children, not something I would do. Even need to think about, our schools in this respect. Okay, so here's another way of looking at it in terms of how we're going to achieve. This is Malaysia, 32 million people. We have this 7% of people that we're most worried about, and some of them still not vaccinated yet. I think about now, but 800,000 still not vaccinated here. A worry for them. We need to mop them up. Some don't have a proper handphone, or some hesitant. Then we have people down here who are not keen for vaccination, adults. I very, very kindly put 10%, but it could be higher. And then there are some people who are non-citizens. Again, I put 10%, but it's again higher. And these people, we need to support the non-citizens. We need to vaccinate them. They will come forward for vaccination, most of them, the young people. their risk is low. But if we don't treat them kindly, especially the undocumented migrants, then we are asking for trouble, because they're again another bunch who can spread the virus back and of course generate mutations. And finally, there's 30% children. Okay, so you can see it's a big challenge to get 70-80% of the community vaccinated. In the past, we said 60% may be enough. We know now that it's not enough. With Delta, we know it is not enough. So we need to make inroads into all these groups first. And the final inroads are going to be children. But let's mop up all these groups first before we talk about children. Why do I say that? Here's data from UK. UK is a very good country to look at. They produce some of the best wholesome data. This is from Public Health England, looking week to week how it's spreading. And you look at this yellow and green line, especially the green line. The green line is 10 to 19-year-olds. And you can see that while the older people who have been vaccinated, the COVID testing numbers have dropped. Even their hospital admissions seem to be slower in growing, but children is rising right now. And of course, young adults who have not got vaccinated also rising. Okay, and here's again from Public Health England and one of their colleagues there who's produced the orange one is their second wave, the third yellow one is their current wave, and you can see hospital admissions to children are going up and up. They currently estimate that for every 100 children, one is getting admitted in hospital. Okay. And so they worry that what we've done right now with all the vaccination, we've pushed the vaccination to the unvaccinated, which are younger cohort people. Less hospitalization, less ill. But if this outbreak grows and grows and grows, again, you can overwhelm your health service quite easily, because you're talking about hundreds and thousands and millions of people infected. All right. So will vaccinating children benefit families and society? I think children cannot be a priority. As I said, vaccinate all adults first, and responsibility to other adults. Okay. So what are other nations doing? I think that, a lot of countries have started to vaccinate children from 12 and above, but the World Health Authority does not currently recommending vaccinate children. I think the primary reason they don't recommend is they want the vaccine to be shared with other countries as a purpose to end the pandemic for the whole world. Okay, the argument about mutations that they're talking about. Okay, in some countries, not even the healthcare workers have all got the vaccine. So I think we need to think about other countries as well. So here's a summary of some countries that I chose. There's more data available out there, and you can see US, Canada, all started. France, Germany, Israel, all started. China just started. Singapore started some time back. Japan, even Cambodia has approved some of the China vaccines. We don't know whether it's Sinovac or Sinopharm, but approved for children. Indonesia also approved, but not used yet. WHO not recommended. Coming back to UK, one of the most sensible countries, they already been vaccinating 16. That means previously their advisory for many of these European countries was 16 and above. That's when the age they consider people fairly adult. Okay, but they had no decision. Actually, they have a decision. I'll give it in a moment. They have not vaccinated routinely children yet. Very sensible country, which is very different from US. Affecting children. So here's a US advisory. They have an advisory committee, worth reading their latest advisory there. A lot of this in the document that I will give to you, the links. And they say in the final summary, which is a couple of days ago, that myocarditis does happen in young children, but the benefit of vaccine to the individual and the population outweigh the risk of myocarditis. Please continue using. If we use it, we will reduce the number of mortality and morbidity compared to myocarditis. That's their risk assessment. So on the US advisory side, good people, pediatricians, public health people, people who are interested in vaccines, who say, yes, let's continue using despite the myocarditis. Here's the flip side. Royal College of Pediatrics in the UK, plus the UK Joint Committee on Vaccination. Again, very good, just as good as our US colleagues, okay? And public health people, managers, pediatricians inside this committee. And the advisory, which they just updated yesterday, worth going and looking at, is down there in the link, and I put it there, that they advise children at increased risk are offered Pfizer BioNTech. So they've changed slightly. Huh? Okay, they say that routine childhood vaccination not supported based on current evidence. Read the big picture. Huh? The big picture is we do not support vaccination in children under 16 right now. But if we need to give anybody, we want to give the 12 to 15-year-olds who've got a lot of disability, Down syndrome, I'm sure the children with cerebral palsy, neurodevelopmental disabilities, children with severe learning disabilities, and children whose family members are immune suppressed. So maybe if a mom has got cancer and chemotherapy, maybe vaccinate the children. Notice they're not recommending AstraZeneca, even though this is a country that use 70% of their vaccines AstraZeneca. because AstraZeneca, the younger you go, the more risk of a bleed in the brain. They're waiting for that data to come out first before they even consider. So they're recommending Pfizer for these children, even though they know there's a myocarditis risk. So they're just giving a small subset of children who they recommend to use. Again, the advisory also says, please discuss with parents the benefit and risk. And then it's a parental decision whether to vaccinate or not. It's not a mandatory decision here. So just out a couple of yesterday. Okay, there are many discussions going on in UK right now. I've linked some of this in the document, but I've read all of them. But I want to suggest if you search for British Medical Journal, BMJ, COVID-19 vaccination in children, you'll find this. And many of them can be read even by the layperson. They discuss the pros and cons. Should we vaccinate, not vaccinate? And I think it's worth reading the pros and cons as a parent and getting some insight from different perspectives. All right. So what do I think? I think we must take every measure to prevent our child from getting infected. I don't want your child to get long COVID. I look at the videos of children with long COVID in UK and it breaks my heart. Mommy, I can't play anymore. I want to sleep all the time. You know, I'm so fatigued, you know, and that's looking at the child 3 months after the COVID infection. Okay. I think we need to vaccinate children. To vaccinate children, we need to consider the risk and benefit. And here's our data from Malaysia looking at risk benefit. This was published last year. It doesn't include, it looks at children, but doesn't really have a children focus. It's an adult focus. Remember, this is at the best of times. Our ICU was working fully well. Every person infected was admitted. There was no quarantine centers. And for 100 people infected, 8 became severe, 3 were ventilated, and 1.5 to 1% died. 10% I estimated from long COVID. Okay, but it's higher than that probably for adults. Okay, so this is the best of times and adult data, not children data. Okay, and here's my looking at the big picture again and risk benefit. You know, many of us are worried about this. The one that I shared just now, the Pfizer myocarditis and all that, those kind of risks, AstraZeneca risk and bleed in the brain. But this is the deaths from COVID. You're going to get children dying from COVID. All right. So will the vaccine damage some of our children? Yes, it will. I cannot lie to you. An occasional child, rare, but it's going to happen, very small. Huh? But a few children will die from COVID. And some children get long COVID, more in adults, of course. We don't know the size of this. But a lot of children are also having struggle. I saw the suicide rate has doubled this year compared to last year. And a lot of suicides in people who are older teenagers and young adults. And that's not pleasant. So people are dying from other reasons, from other health problems. And finally, you know, children are getting malnourished. People, you know, another 3-4 million Malaysian parents have been pushed into poverty. Their children are not going to do so well. So this is the big picture that we always must consider. And I'm a big picture person while I think of the small one as well. So in the US, they've put up a risk benefit analysis. I'm not going to discuss with you. I want to look at mine from all the available data I can give. This is from US, all the available DS data. And this is vaccinating 1 million boys aged 12 to 17. So if you vaccinate 1 million boys aged 7 to 17, look on the left side here first, they can prevent COVID infections. Again, this depends on how big the outbreak in your country is. They've controlled the outbreak, so this number doesn't look good big. In Malaysia, this number may look very much bigger, okay? Then hospitalizations prevented in children. These are all children only, yeah? ICUs prevented and deaths prevented. So to vaccinate 1 million children, this is what the risk benefit will look like in the US. And for the bad side, the risk side here, side effects. Now, I've taken the bad side effects, not the severe side effects. These are the ones where, oh, you got knocked off your feet as a child. You know, you had to sleep for 1 or 2 days. You know, you had very high fever. You know, you couldn't move your arm for a while. That kind of bad effects. Not too bad. Like we can overcome that. They're short term. All right. Myocarditis for boys, admitted to ICU. We don't know about deaths just yet. Probably small, but this is the risk benefit looking at both sides. Okay. Here's for girls. Again, numbers much smaller for girls and numbers for myocarditis much smaller for girls. So girls seem to have a much easier time than boys. Huh? Generally, women seem to have more side effects than guys. But for Pfizer and Moderna in children, it seems to be like this. And thank God, you know, I know girls are always tougher than guys. You know. But I haven't factored this one into the equation. I come back to boys and factor this in. What is the size of long COVID? If 1 million boys are infected, are we looking at 10,000 long COVID? We must think of that in the bigger equation as well. And don't forget my bigger picture discussion here, this whole issue here, we have to think about it. So I'm coming now to a summary in case. I have no answer for AstraZeneca in children. All I know is that we know that it gets bigger, the bleed in the brain, as you get younger. I think people will be hesitant to give it in young children at the present moment. Okay. So here's my summary for you, and I've got one more simpler summary after this. If COVID is widespread, this is supportive of vaccination in green, don't want to vaccinate here in red. So if COVID is roaring in Malaysia like it is right now, it's spreading all over the place. Oh God, I'm worried about long COVID. I'm worried about some children dying. I think, yeah, vaccinate. If we see long COVID risk high, vaccinate. If the vaccine is effective, of course, vaccinate. We know the vaccines are effective. But if the side effects are huge, is it 1 in 20,000, 1 in 27,000? Is it lower? We don't really know the full figure, but it is not small. It's at least 1 in 20,000. I told you to remember that. Okay, sorry, I didn't change this figure. It's 1 in 20,000. So that is against vaccination. And we don't know enough about Sinovac, AstraZeneca here. But if you want to return to school, reduce our children's psychological trauma, maybe a vaccination is necessary. If you want to benefit society and get back to some semblance of normality, then vaccinate children. But if we have not finished adults and we haven't helped the world, maybe don't vaccinate children yet. And finally, if you want to prevent new variants from damaging children, or not allowing new variants to develop, then we need to vaccinate children. Difficult risk benefit. Huh? In the end, this is how you're going to decide. This is how I decide. This is how IKI decide. It's the children's needs versus the community needs, your family needs versus the country needs, isn't it? We have to think both these issues and you have to balance this. And nobody can make this decision from you. In some countries, they're talking about mandatory vaccination. I hope we don't do that. I think we must allow people the choice to vaccinate and do this. Huh? So here's my personal opinion. All that was data. Now I'm going to give you my personal opinion. If you ask me, and people have asked me, I don't think we subject children to mass vaccination just yet. I think we should vaccinate all adults. We should go all out, work with the hesitant people, the WhatsApp people who get lots of, COVID-19, horror videos and all sorts of crazy stories there. Please verify them before you send them through. So these people, plus the migrants, and just see what this does to our pandemic. If we can touch 70% of our population, then we see what happens to our children. If we cannot, okay, after we've done 60-70% of our population, we still cannot. Let's then aim at children and don't just do 12 to 17. Start with the oldest cohort and work your way down. Work 16, 17, then 14, 15. So while we're doing that, we're generating data on severe side effects as well. And that's the safest way. Let's not just rush down to the 12-year-old, okay? And this, of course, will bring recovery to our children because it will help with schooling and all that. Because when your country recovers, children also recover at the same time. Huh? Having said that, I also want to choose the safest vaccine. I'm not convinced the current vaccines are the safest vaccine at the present moment. Huh? So I believe we do this when we have no other option. Having said all that, this is always in my mind. If long COVID data is clearer, if new variants appear and they damage children more, and if the outbreak goes wild, then all these things I said become meaningless. We may just have to go ahead and vaccinate children. Okay, so bear in mind that this is a plus and minus that I'm saying to you. But right now I'm saying let's not rush into vaccinating children. So what new vaccines I'm talking about? We've got the AstraZeneca viral vectors. We've got the mRNA, what is this? Pfizer vaccines. We've got the whole cell vaccines like Sinovac. But we also got other vaccines developing like the protein subunit. Many of us are looking at this Novavax vaccine, which is out. We're just getting a little bit more data, probably by the end of the year, ramp up their supply. And this is the same kind of vaccine we use for, diphtheria, tetanus, and pertussis, the DTP kind of vaccine. Seems to have a very, very good efficacy and seems to have, some of the best profile. And I think this is the kind of vaccine that probably might be safer for children, all right? Some people will ask you what vaccines we have in our country right now. We're using Pfizer, we're using AstraZeneca, and we're using Sinovac. We have approved Johnson & Johnson, which is a single-dose vaccine. We have approved CanSino Bio, which is a single-dose vaccine. We have not approved the Sputnik vaccine. Moderna is not coming to our country. I think it's a supply issue. And as I said, we need to look hard at Novavax, which we have not purchased yet. But maybe we should look hard at the data and consider purchasing this specifically for children as a safer vaccine. Sinovac, again, we must try and look hard at the China data as they start vaccinating their children and see how that vaccine behaves in children as well. Some people will also ask about the unborn child and the child they're breastfeeding. Please look at the documents. I've given you one of them, an MOH document about breastfeeding and pregnancy. And currently, MOH is saying vaccinate after 14 weeks when you're pregnant, 14 to 33 weeks, and they are recommending any one of these 3 vaccines, Pfizer, AstraZeneca, or Sinovac as vaccine. When you're breastfeeding, there is no danger of these vaccines. You will produce antibodies. Some of them will come out your breast milk, but they're considered protective to your baby rather than harmful. Last area that I want to just quickly say some words about, and then we go to question time, which is, how to get back to school safely. I think the most important to get back to school safely is don't grow our community transmission, kill our community transmission. That's the best and safest way to get back to school. But in lieu of that, with that not happening, I believe these are the 3 principles we must have in working together. First, as parents, you must work with your school. School, please work with parents. You need to have a very, very close thing. You cannot say, oh, we follow the authorities. No, I think parents must be intimately involved with the school authorities and create a safe environment. I have a lot of parents telling me, I tak berani nak hantar anak pada sekolah. Not safe. I see other people not doing anything, close proximity, no mask. So I think we cannot allow that. We must ensure the SOPs are not just there on paper, but followed. Okay, so number 2. Number 1, we must work very hard on preventing children from getting infected. So the key in life right now is don't get infected. Adult or child, don't get infected, because the services may not be there to support you adequately because they overrun. And finally, don't forget poorer families, please. Those of you who are listening here are not in this category largely. They need our support. They may be wearing the same 3-ply mask for a week. It does not, it does not help your child if you don't help other people's children. You want to help your child, you better help other people's children. We need to share masks with them. We need to have hand sanitizers and other things with them. We need to work with them. So I've got a long bunch of lists. And in the list, I've got must do, good to do, enhanced measures, ideal, and tough areas to deal with. And let me just cover the highlights. You go and read the details for yourself. There must be a trust bubble between staff and parents. Your child is ill, don't bring to school. Don't bluff, give paracetamol, Panadol, and take him to school. Okay, you've been exposed to somebody who's positive. Keep at home, test, don't bring to school. As a parent, please do that. As a teacher, same. The moment one staff is positive or been exposed, you must tell that class. All the parents must know immediately. Don't hide this data at all. We see a lot of data hidden, okay? We don't like that. And similarly, if anybody travels, they must test before they come back to work, okay? So clear lines of action. And if one child is infected, the school must have a clear idea. The way to work is a class safety bubble. We don't mix classes at all. No assembly time, no play time together, recess time also cannot be together. The class only works together. So if one person in the class is infected, then that whole class and that teacher stop coming to school. We test everybody. We don't have to kill the whole school with this mechanism. Must mask everybody. All children and staff wear masks. If you feel nervous, wear a face shield. I wear a face shield and a mask, both of them together. All right. And as I said, support for our children. We need to deal with contact surfaces, which is not spraying all the air with all these things, but the contact surfaces, the handrail, the tabletop, and stuff like that. And we must look at ventilation. Ventilation is a lot more important than contact surfaces right now. So we need, and I've given some ideas how to do that, how to exchange the air in the class more often. Keep it open, don't use aircon. Open all the windows and doors. Use a stand fan at the window to blow air out, okay? And be prepared that you may go back to a hybrid school. Half the children come on Monday, Tuesday, Wednesday, the others come Tuesday, Thursday, Saturday, or you have go back to online, a mixture of things, and you have to fluctuate, okay? Don't be frustrated about that. Enhanced measures, all children, all teachers and staff vaccinated, not just the teachers, but the support staff in school, including the bus scholar person, okay? I think we're coming to that. But again, like the UK, I think special needs children need a special look at. We mustn't defer them going to school, and those with a lot of respiratory links, children with Down syndrome who get easily infected, children with higher mortality in COVID with Down syndrome, with cerebral palsy, children who have got lung problems and all, I think vaccinate them, okay? They're at higher risk. This is a group that I think we should consider vaccinating, especially the older kids. Again, notice these are enhanced measures, not basic. The ideal, all parents of children vaccinated. This actually reduces the risk in the school considerably, okay? All parents of children vaccinated. Every adult around this child is vaccinated, grandparents and all that. Everybody at home. Then this thing, which the UK has been doing for a very long time. They were the forefront in this. Other countries also following. They do twice a week, every 4 days, they offer an antigen test to all staff and students, everybody going to work, all people who go to factories and workers, they're offering this. This is done at home. They have an honor system. You test at home. If you're positive, you report, you don't go to school. Okay, they're offering it free. Okay, so if we can find a good quality antigen tests which are cheap. Right now, the Ministry of Health has approved 2 for testing which have a high, sensitivity. They're good tests. Then we should do this. You cannot do this in school, my opinion. You like to think, okay, come to school, donate saliva test. You got to take off your mask, expose yourself to a teacher. There's a whole gang of children waiting. Imagine 300 children waiting to do a saliva test in school. Tak jadi lah. Same at work also tak jadi, this sort of thing. You're going to do this at home and have an honor system. Okay. I believe if this test come down to Malaysian ringgit under 10 is doable. In Singapore, it's being sold at about 10 Singapore dollars right now in the pharmacies, widely available to people. So keep an eye on this. I think we need this yesterday. It's already available, and you need to work with your general practitioners and read the data, which tests are reliable. Don't use an unreliable test. Okay. Should we vaccinate all children? I've talked about all that already, and I won't say that, but this is ideal when we have no more option. Then we start with the older children, then we work our way down. And we actually can optimize ventilation in classrooms even better than what I talked about. A lot of doctors have bought carbon dioxide monitors. Again, there are a lot of con ones out there. Be careful, buy good quality ones. And this can be a proxy indicator of whether air is circulating in the class. So I would buy a carbon dioxide monitor for my class if my child is there. And, if it goes up beyond a certain point, you can read this online, then, the air is not good. We need to work on improving air ventilation. Together with that, you can buy portable air cleaners. Please don't buy the ones that are being advertised. Most of them don't work. It's not an air purifier. It's one that has a MRFs, has a minimum efficiency reporting value of 13 plus, air cleaner, 13 or plus, and it exchange a large volume of air with this. And for aircon, if you're using aircon, it's got to be a HEPA filter so it doesn't recirculate the same coronavirus particles back to other people. Even with aircon, you got to open your windows and have air being sucked out. So we can actually improve that. Again, the school cannot do this. There's no money for this. By the way, these air cleaners can be DIY. I did share with Tiffany a file of DIY air cleaner making with a video how to do it, and she's welcome to share this with people if they want it. Okay, I didn't put it on my list earlier. So think about this as a possibility. I saw it on Lazada, these filters, but again, you have to custom make it yourself with a fan. Tough areas I don't know what to do. One is break time, recess time. This is when you take your mask off. One option is school, only 4 hours, we don't eat, we go at home. Okay, maybe possible. The rest we do online, maybe possible. But if we're doing this, break in groups, make sure the canteen is open air, buy tapao lunch only, or you bring a packed lunch and you eat outside alone, take off your mask. Horrible, huh? Cannot socialize with makan. So the time we always want to meet together is makan time. But I'm talking really safety here, okay? And again, don't forget that we actually need the break time because a lot of poor children come to school. 600,000 Malaysian children depend on school meals for their protein source. So I think we cannot really do away with break time. We need to think about them and give them their meals. If we keep school short, then we must give them a packed meal that cannot go bad, food that is viable, that they can take home to eat. But otherwise, meals at home is a difficult time. This is where many of the outbreaks are happening. Whether in the PPV among the staff, it's probably the makan time. Whether in hospital among doctors and nurses, it's a pantry. This is the place you must worry. Office also same thing. Don't makan together. Toilet is the other place. Very poorly ventilated, a lot of high-risk surface. Don't take off your mask in the toilet. Okay, must put in exhaust fans. I think something you must invest in, and keep it on all the time to suck air out. Then finally, don't forget the bus cola for poorer children. That's another place to get infected. And we need to think about, don't aircon your bus cola, open your windows, wear a mask in the bus cola. Finally, supporting children. I like this graphic artist, drew things on masks to try and show our time. What a time for children. I think it's a fearful generation right now. We're going to get a lot of long-term anxiety and fears and stress disorders and trust problems and so on. And I have written this for you. I'm not going to go through it and talking about how we need to build our own resilience as parents using routines and joy and physical activities. Please read that document. I think online also 1 or 2 talks that I've given talking about this, but I'm welcome for you to ask me to do for a large group if we need to do that again. But this is the one thing you need to consider. Okay, this is a COVID safety bubble, a network and individuals. And how do I envisage this? This is once your EMCO in the Klang Valley is over, but for those of us who don't have an EMCO, we probably can do this. You set up a COVID safety bubble for your children need other children. Children cannot live with other children. Of course, they can live with their adults, but they need other children. And we need to meet in a trust bubble, a trust safety bubble. And so I would pakat, I would combine with 2 or 3 other parents, maybe 4 parents at the most, not too many. Maybe our collective children are 5 to 7 children in these families, and we invest in good antigen tests, and we test. So we test every week. So government may not have started it for us, but we test, and then we arrange a meeting for everybody. So everybody tests, all the family members test, including the children test also. And then if everybody negative, then we come together in one person's house. Children can run around, talk without masks, have fun. Okay. And it's the same group of children who meet once a week, have fun, might even be able to hug. Wow, that thing that we don't remember to do anymore. Hugging, okay. Play with toys, things like that. And it's the same group of people meeting. I would not include old people in this because, COVID can still spread despite vaccination. So we don't want to get the increased risk. So you see, it's the young adults who may want to come together. Or, maybe one set of parents might host it, the other parents bring their children. But everybody must test before coming and test weekly. You test bi-weekly, even better. The moment you're positive, of course, everybody needs to go for a PCR test. Don't forget that. It's a problem. But this is one way to bring back some reality to children while we struggle long-term with how to bring the pandemic under safety. I want to say and end with this, I'm never really sure who's a doctor in all the years I was working. I always thought I was a learner, a student, and the children were my chegu. Parents and children have always been my chegu. And this boy taught me a lot of stuff. Notice he's examining me and he's taken over the doctor's chair. I never liked this doctor chair nonsense, always that our chairs are all equal. And quite often I sat in the patient's chair so the patient could, I don't even call them patients. The children can actually articulate better and take a position of authority, which I like very much. And I believe this is what we should articulate in this thinking of vaccine, the UN rights of the Convention of Children. In all actions regarding children, the best interest of children should be our primary consideration. So although we want to think about society and other people, don't forget the best interest of children. Let's not sacrifice children at the expense of society. And that's my final slide here right now. Let's take some questions.
Thank you, Amar, for that really, really comprehensive, so complete. It really covered so many, many areas. And I think one of the take back, I've listened to you speak in several platforms, and every time there is a different thing to take back. And I think it's got to do with how the situation moves so dynamically through the weeks, and it's so fluid. But one thing holds true, that we always hold the importance of our children versus the community and the nation. So that was a big takeaway for me today. Thank you so much.
Thanks, Ike.
We had a long list of questions in like the pre-registration questions,
Yes,
but Amar, you have answered so many of them. I'm like just ticking, and thank you
Thank
so
you.
much.
Yeah.
So we're just going to go into some of the questions. I think let's tackle the vaccine itself first. There were quite a few parents, understandably, who are concerned about their own children with their respective problems. If I can just sum them all up, Amar, would you say that you would recommend, if the time comes and recommend and vaccine is needed, are the vaccines safe for children in this category of conditions? Number one, chronic conditions such as asthma, epilepsy, some congenital heart diseases, just as a whole. Number two, children with previous illnesses, for example, Kawasaki or leukemia in remission. Yeah, those two, because I think you've covered for those with severe egg nut allergy, we should say it should be done in a more controlled situation, more controlled place, as well as we do need to look into the needs of special needs children such as Down syndrome and autism, ADHD. So yeah, chronic conditions that are very common in childhood, as well as previous illnesses.
Yeah, there's more. So I saw one question pop up in a chat group also about leukemia and stuff like that.
Yeah, and
Again,
mitral valve.
yes, again, can I suggest you look hard at the MOH guidance, which is for adults right now? But a lot of chronic conditions are mentioned in there, even all the leukemias and stuff mentioned. A lot of appendix is a long document. Just search for your own condition and you can find it. Generally, if you have a chronic condition, you need vaccines more than people who don't have any chronic condition. Okay, that's a basic principle you must recognize. You're more likely to die. Having said that, some chronic conditions are less likely to respond well to vaccines. If you have an immunity problem, if you're being treated for a leukemia, if you have immune deficiency, I believe that you should consult your local pediatrician. And that's what MOH is going to say also if we make a decision about children vaccination. These are children who need to consult the pediatrician to make a personal decision based on your current situation. Okay, so chronic disease like heart, lung disease, or definitely if you want to vaccinate, the vaccine, definitely the risk is about the same as other individuals, other children, but the need is greater. But what about those with allergic-like conditions? If you have eczema, you have urticaria, where you get a sort of a sudden swelling of your hand, or maybe even worse, swelling of your face. What about asthma and so on? There is some data showing that uncontrolled asthma is not so good with COVID vaccines, higher risk of anaphylactic risk with them. I've read data from that from Europe. So I recommend that any child with an allergy, again, you need to discuss with a pediatrician. And secondly, I'm very conservative with children. I want to protect children. I think children with some allergic risk, let's move them to a safer place to vaccinate, not a clinic, not a PPV, but a hospital setting where pediatricians can be present and we can support them, assess the risk and support them. So I think there should be a risk assessment for children with any form of allergic condition. So notice that I've mentioned 4 groups there, or maybe 3. Those who are disabled and chronic conditions, heart or lung, actually need the vaccine because they're higher risk, than other individuals. Those who are allergic, we should push to a safer place to vaccinate. Those with immune deficiency of any sort or on treatment with drugs that drop your immunity, you need to consult your pediatrician and then actually make a personal decision for vaccination. Okay. Again, all this depends whether we make a decision. Remember the conflicting views. UK, not yet. US do. So I think the jury is still out about this.
So I really think that we actually have a little bit of time. We're not into phase 5 yet, so we've kind of have time to continue to evaluate the situation and the data coming in, isn't it? Yeah.
Yes,
so,
I believe that looking at our vaccine strategy right now, the hotspot states by next month should reach a maximum vaccination situation, and then the rest of us by September. So we're going to last August. By September, we should reach about 50%. Then by October, I think that's when we start thinking. By October, I think most of the adults are going to be mopped up. And what's going to happen is our vaccine delivery to the doctor, and then we're going to start pushing for children. That's happened in UK as well. Okay, as the vaccine delivery drops, then they say, hey, we got a lot of vaccine supply here. We should vaccinate children. At that time, we must make a decision as a society, as a pediatric association, as a Ministry of Health. I think everybody should chip in to make this the best decision for children.
Yeah, so we really need to take a look out on this, in the coming months. Another question, Amar, is, and I get this quite a bit as well from parents. Does flu vaccine, is flu vaccine effective against COVID? I think.
Oh, definitely not. Full stop. Can just answer that. No. Okay. Is it good to take a flu vaccine? I think if you're older, yes, it's good to take a flu vaccine, especially and for some young children as well. I think if you've got a chronic disease, even more important, it protects you. Okay. But if you're going to think the flu vaccine will protect you against COVID, no, sorry. It's a totally different virus we're dealing with. Yes.
Yeah, absolutely. But I think many pediatricians, if not pediatricians, we still advocate to give flu vaccines, especially to the very young as well, for like a few reasons, because we don't want a double whammy.
Agreed.
Clinically, sometimes we're not able to differentiate between the two, and it's horrible if you can get 2 infections at the same time. Rarer, but it can happen. We don't want a double whammy on that. We want to also protect our children against all the other viral infections that can still happen apart from COVID.
Agreed. And there's another reason, Yiki, there that, less people who get sick from influenza, the less come to hospital. So we don't strain our services as well.
Absolutely. Yeah. Okay, great. Let's move on. There's a question. This is a tough one. I think it's the one that we parents really struggle with from day to day when we decide whether this week are we going to send to school or not, because there are schools that are open to cater to families who are frontliners. There's some parents that we just can't, we don't have the ability to work from home kind of thing, and some sent to daycare. In your opinion, which do you think is worse, the risk of COVID or having to deal with the psychosocial and educational problem? Tough one, tough one.
There's a third one here. So the risk of COVID, the risk of psychosocial, and the poor children. I think right now, 4 to 5 million families are living in severe poverty, struggling, really struggling without food security. Those children are struggling with food. I think that's another one, and bringing it back to school would give them some food. So I'm not blind to those children's needs. So we thinking of our children's emotions and mental and spiritual well-being, they are just thinking cari makan, kind of thing. So yeah, so I think for that last group, there's no brainer. I want to support them, which is why I think it's an all of society support. Let's support them so we don't have to make this painful decision about school just yet. We support them with food. And I think many of us are doing that. More need to do that. If every Malaysian, the upper 50% supported, every Malaysian, the bottom 50%, we have no more problem about food. We cannot hire up the government's safety net because it is not good enough. We need the NGO and the individual safety net. But yeah, I agree for the other group, the emotional turmoil, I was with Iki and the other people and the gang chatting about last week. And was it Iki or someone else who said, my daughter's gone to Standard 1 and has not been to school yet. And she asked, Mommy, will I ever go to school? Oh, I can't even, that kind of broke my heart, that kind of comment from a child. I think, Michelle, was it you or someone?
Was it Seljin or Yinling, I think?
Yeah, okay. Yeah. So it's frightening to have children say that, Mommy, will we ever go to school? So I think children are facing the brunt of a lot of our own despair and emotions, and they're feeling it. So I don't know which is worse. I think both are bad. But imagine if everybody went back to school, we didn't protect ourselves adequately, so many long COVIDs and some children end up in ICU. I don't know when I could face that as well. Okay. Finally, can I also say that not all schools are the same.
Yeah.
You could go to a good home school, wealthy one, or a good international private school where everything could be taken care of and things are tip-top, and that's quite safe. Or you could go to a national type, governmental school where it's chaos. During the time they opened schools, I went to look. I brought my long lens from far, not as a stalker, but I went to see what's happening from a distance. And I'm frightened. There's almost no SOP in many schools, People just chatting about no mask wearing, running about. So despite we say we have SOPs, I do not believe the reality is true for a lot of schools. So that's why I say we have to fix that. So I think that equation is not so simple, that question. If you want to go back to school because of our children's emotional well-being, we need to fix the safety element in our school, which means ventilation as well.
Yeah. Which brings to the question a parent asked, how do you feel about the planned opening of schools in September?
Oh God, I try not to conflict with authorities as much as I can, but I think it's premature. I think our pandemic is huge. We don't know what the Delta variant is going to do in the next couple of weeks. People have been more mobile now with this new bunch of holidays, I look at Sarawak and I see Delta spreading in the Kuching area, even though they seem to have controlled their pandemic a little bit better. So that could be happening elsewhere. Sarawak's got good data because they've got a university which is testing a lot of genomes. Many of us don't have that kind of thing. So no, I think it's premature. And I believe even the Minister of Education has said, target to open, but in phases and looking at situations. So I believe that it's a fluid thing. The problem will come like this, okay? Your school opens. You're a middle-class parent, your school opens. You're not feeling secure. The school hasn't made enough arrangements and hasn't engaged parents enough. So you don't want to send. So where does your child go? Online is stopped. So do you move school to somewhere else? You don't have the financial resources to move to another school. Messy, huh, that time. Okay, difficult decision for parents.
Yeah, that's so true. then, if we were to put it into like a smaller scale, would you advise, like, we can't do it for the whole school and resources are not there, but do you think we could like band together, like some parents together and do that home? Because now, I mean, that's a good piece of information that's just come out in a couple of days, like compared to before, that we have now home kits. Then they're not fantastically budgeted.
Yes.
I think it's about 30 ringgit. I've heard of someone buying from the pharmacy at 30 ringgit. Even that is all sold out now. But if we're able to do that, would you recommend for like small groups of people to band together and do that?
Yeah, I suspect that the homeschool movement is going to grow. I'm not saying I'm for or against it, okay? Right now, 30% of Malaysian children are not in a government school. They're not in the government Malay medium or government Chinese medium school. They're either in private homeschool or in a tafe school or something of that sort, okay? Or a private Chinese school, something like that. So the homeschool movement has grown very big. I suspect in this time it may grow further, and some parents may take the responsibility to become teachers, take an online curriculum from the US or UK, But coming back to the kids, yeah, that's a possibility. EK, I think we need to explore it. I'm a realist person. I think we do what's best for our children. Again, you need to think of similar age group or something, similar in some form. Although homeschooling just allow diverse kind of ages to work together. The kids, I believe, Yiki, we can work to bring the price down if doctors work with us like you. Doctors can probably buy at cost. You buy through a pharmacy, there's going to be a bit of an increase in price there. So buy in cost. And I would look strongly at the two that Ministry of Health has approved because their sensitivity is 90%, which is very, very good. But some of the others are also good. So somebody like you or me will have to sit down, or others sit down and trawl through all the kids' data and say, okay, these are the ones we recommend. But some company will say, well, you don't recommend mine. Very, very sensitive this issue. So maybe do it privately and say, okay, these kids are the ones that we can get access to, and then this is the price that we can bring it down to, and then people make a decision. But as a parent, if I can test once a week, minimum once a week, then and I have to pay 20 ringgit. I think that's no brainer for me. Makan also, I can go and eat a meal for 20 ringgit without thinking hard. Okay, but if I can do twice a week for 10 ringgit each, or even better still, do one on the Monday, do another one on Thursday. Yeah? We might even then get back to thinking whether we want to use masks in the small group. Again, you only can do that if the rest of the family members are reliable. You don't have somebody in the family who is gallivanting around here and there, doesn't have a good SOP, then, he can infect the child, they can infect everybody else in between the two tests. So we're again looking for a lot of trust here. But it's one solution, yes. Maybe initially come back with masks until we're not sure people, then maybe move to a less mask environment here.
Take it step by step.
Yep.
Yeah. I just want to bring you back, Amar, to when you mentioned about supporting the underprivileged and families. There's a parent, I think, is deeply moved by that, and have asked if do you have the contacts or the NGOs or that the person, if they want to donate or to contribute to.
Sure. I know some in the Klang Valley. I know some in my area. My wife and I support one NGO extensively because they set up food banks in different smaller communities, poorer communities around, and we throw money at them as much as we can. My wife, of course, gives to individuals extensively as well. We've been doing that for about a year and a half. But the Kita Jaga Kita is a powerful movement. They've got a website where people raise a white flag and say, I need help. And you can raise a flag saying, hey, I got resources, and you can match them together. That is a site I would push to you because it's a site that kills the middleman. Having said that, I will also in the Klang Valley look at the good MPs. For example, like Hannah here is phenomenal. I would go and put money in her hands. Look for NGOs that you know are reliable, have a track record. Talk to them and give them money. That's what I've been doing right now. Just because they're new doesn't mean they're not good. You've got to look at the people who are running them. I look at the person and I know I trust this person. I know that money is going 100% down back to on the ground. Okay, but some other solutions people have done. You could go to a mart. You have what mart do you have? 7-Eleven. One other mart that opens in Klang Valley quite a bit.
Speed 99.
Yeah, that's right. Speed 99. You have a lot of those around in Klang Valley, correct?
Yes.
So some people, what they do is they put an account there. okay, and say that if this is my account, if somebody comes with this voucher from me, they're allowed to buy the amount that's on the voucher. So some groups are doing that. I know CRESS, the disaster group, is doing that. They're giving out vouchers. So that way, they can give the family, okay, I'm supporting you with this vouchers for the next 2 months. Every month, you're allowed to go and buy X amount of goods from this place. And they specify what goods also, if you like. So that way you don't have to give cash directly to them. You can then pay the 99 Mart or 7-Eleven or whatever you want. That's another way to do it. The third way is maybe identify families in a community through your local network or your church or whatever, and then say that, okay, I'm going to support your family for the next 6 months. My family is going to support your family and your children. And that's one way. Adopt a family, adopt 2 families, something like that. Be imaginative.
Yeah.
Iki, there was a question about pool testing that popped up for a moment.
Yeah,
I thought I better
correct.
handle that.
Yeah.
So yeah, you can actually maximize your kits by doing pool testing. You need to think how to do it properly. For example, I saw this lovely video from Israel at the major airport. They do 60,000 tests a day. Wow, just the airport alone. Okay, that's more than about half of Malaysia. There's more than half of Malaysia, this whole country. And so they do it by automation, but they also do it by pool saliva testing. I think they pool a certain number, I can't remember, 20, 30 samples together. But that means that if any one pool sample is positive, then they have to retest everybody in that group. But it means that you can save money. But you got to see how you do that. They have centrifuge, they spin the sample down. I'm not sure that's possible for the average family home testing situation. Okay for hospital testing.
All right. There's a parent, I think just above that question,
Yes.
looks a little bit of a time sensitive. So I should ask that she has a 17-year-old daughter who's outbound to UK in September.
Yeah.
She's obviously not in the current phase of vaccination in our country, but would still like to vaccinate. Is there a way to do it? Yes, right?
Yes, I think MySejahtera does support this kind of thing. Go to MySejahtera. You can say you're going to go overseas as a student. They did have announced that they are supporting this. There's also the announcements from both Europe and US saying that you can come with any vaccine. We will still allow entry inside the country. But better to check with the local regulatory authority. If you're going to UK, better check with UK what they accept. I would not, at the present moment, give this child AstraZeneca as a person. That's my personal opinion I'm giving there. Go for Sinovac or Pfizer for this particular child, but recognize the risk. We don't know enough about Sinovac severe rare risk, but we do know that 1 in 20,000 myocarditis for this child's risk. And so go with that understanding. Yeah, but I think can on the MySejahtera.
Great.
Having said that, sometimes, Iki, the easier way is to talk to your local PPV. If you can find somebody inside PPV, you can talk to your local health authority. That is somehow a faster mechanism to get it done.
Yeah, it's true. I have heard of numerous cases where, you have very kind souls there, and when you just ask and sincerely ask, they really go the second and the third mile to help you out.
Yes.
Yeah. So on the same note, parent asks, Amar, do you agree regarding regarding our MOE's plan to accelerate vaccination for older children? Specifically the ones sitting for SPM, STPM in 2021?
Very difficult to answer that. You've heard my own personal opinion. I wouldn't reluctant to vaccinate children just yet. So I think that if you are traveling and you cannot go for your further studies in the UK unless you're vaccinated, then okay, you may have to weigh that benefit. You of course can cancel and study locally if you want to. That's an option. But you may decide, okay, I want to go, and then you take the risk of the vaccination. It's always a risk and benefit discussion, even for an adult. Even when Iki goes for vaccination, she has a risk. She has 100,000 chance of having a severe allergic reaction, and she has to consider that. For me, I have very, very severe allergies. I was vaccinated in the hospital, by the way, because I have a nasty face swelling, huge number of drug allergies, and had a Stephen Johnson before. So my risk is really through the roof kind of thing. And yet I still went for vaccination because I know COVID might kill me much more than the vaccine. So I think that through. I think MOH is trying to give comfort to parents, to trying to get the children back on track for education exams. That's their thinking. So I cannot give you a firm answer, yes or no. You'll have to decide.
Yeah, that's so true. Okay, we've just got a little bit more time, and are you okay, Amar, if we
yes,
still
let's
have a few
carry
more
on.
questions? Okay. The next question it's got to do with disinfection of a room. So what are your thoughts? We know about the ventilation and contacts as well, high traffic contact areas. What do you think about UV lights? Do you think they work to disinfect a room? I know that they're being used in like central air conditioned systems and stuff like that, but what are your thoughts about it being used in a room, like put it up there?
Excuse me, I think in the future, UVC in particular, is going to start appearing in many facilities. I think it'll start appearing in hospitals, for example. So after the patient has left, that room is closed, they switch on the UV light, so it's safe. But UV light has got dangers to you, to your skin and to your eyes, and you've got to be very careful how you use it. So some hospitals in Europe have actually already installed it in the past. Now some are using it by portable UV units, which they bring to the room. They, the people come with all their protective gear, turn it on, and then they come back later. It takes time. It's not one of. I saw one individual who picked up her newspaper from her gate, and then she shined a UV light, and then she went in. Sorry, it doesn't work that way, okay? It's about 15, 20 minutes at least, to kill the bugs. But, that was also dangerous. She was wearing no eye support at all. I think she's going to damage herself more than help herself. So you've got to investigate the safety profile of this. The units at work, don't get somebody who cons you, just giving you some blue light, which is not UV. There are a lot of people who are con people selling con masks, I saw a pulse oximeter the other day, which even a pencil can work and give you a pulse oximeter. With a pencil inside, also got saturation 85%. So obviously, there are cheats out there. So investigate, read, and I often read Europe, Canada, because they've got very, very good guidelines. Buy a unit that works, have a safety profile, bring it to a room and shine. Okay, long term, as EK says, they should be put into the aircon systems to clean them. And I think that's going to be a long-term thing. And long-term, I believe they should be come into the ceilings of many of our buildings, maybe even schools. You can turn them off after the children have left. Everybody has left, disinfect, and then next morning it's clean. Yeah. Right now, I think it's going to be portable units, and you need to really, really be careful about their safety profile. Not something you want to do in home, got to be done in larger places. So in terms of airborne surface infection, spraying some infection around, please don't do that. No, I think it's not really useful. So, clean only the surfaces that are valuable to clean.
Great.
Wipe them.
Great.
Yep.
Yeah, wonderful. We're going to go into a little bit of a dangerous situation here, but how shall I put it? I think, Amar, even in our fraternity, the talks about, I'm sorry I have to do this, but I think there's so many parents asking, and I'll try to put it in a way. Even in our fraternity, we're pretty torn. And I'm going to be honest, you're all pretty torn about the role of ivermectin in COVID. But I think the vantage point I want to take is that what a lot of us are affected, or rather annoyed, is that people are thinking that ivermectin can be used as a prophylaxis in substitute of vaccination. Let's not talk about whether it's effective in a COVID infection or not, because I think one of the things I want to say is that our Malaysian government is doing a study on that, right? And that's something to look to, and I think it's really responsible that our Ministry of Health is doing to collect local data regarding this medication. But what are your thoughts with regards to, ivermectin being used as a prophylaxis in the place of vaccination?
Okay, I'm going to digress just for a moment, and let's come back to Sinovac. Don't for a moment think that I don't like Sinovac. I just want data. I'm a data person, and I believe that's the way we should have science and data to drive us. So right now, for Sinovac effectiveness, there is good data. Chile has published a good study, and I think a lot of us are very pleased with it, that hospitalization and death reduced. So that's good for Sinovac. But I would love to see Sinovac rare side effect data, which I have not seen, and that sort of thing. So that's why if I sound hesitant about it, it's just that I want to see the data, okay? But I think the Chinese government is quite a smart government, and they wouldn't use a vaccine that's not good. Of course, right now, they're also considering booster doses, and many people will have to consider booster doses in the future. Now, coming back to ivermectin. Ivermectin, there's a lot of big lobby on both sides, and some people have become very, very strong about their opinion. I look at data, and I would recommend to those of you who are thinking about this to search for these terms, search British Medical Journal, just BMJ will do, ivermectin and evidence. You will find a good review written by a very authoritative medical journal talking about how the current studies that have been done for ivermectin still lack adequate quality and depth for them to be used. So coming back to your question, Nikki, I do not believe at present the data supports using ivermectin routinely. I think popping one pill every day instead of taking a vaccine, I don't think that's a good solution. The data for the vaccination is a lot better than the data for ivermectin. Having said that, I want to keep all options open, and I would like to push everybody to actually generate more data for ivermectin. Also, you saw what happened recently. Somebody falsified the data for ivermectin, sadly, and that's damaged the ivermectin lobby. So sad. This large study from Egypt, where they cooked up the data and then they published it, and some kind bright medical student spotted it, and and Bocho, thank God, the Russia. So that has damaged the ivermectin lobby as well. We don't need that kind of bad science. We want good science, and then we follow the science together so that as a medical fraternity, we can give a very clear opinion to the public and don't look divided as we are right now.
Yeah, I absolutely agree. Thank you, Amar. We're just going to move on to a couple of very practical questions. A parent asked, what lifestyle and food can we adopt to boost our immune system or our children's immune system? It's like a very common question that comes almost at every clinic.
I'm not sure. I believe you're eating enough of the basic food groups, especially vegetables and fruits, and they're fresh. Good luck. If you kill your vegetables and cook them until they die, I think then you're doing some harm to them. That's good enough. Who needs supplements? The poor need supplements because they don't get enough nutrients. Those who are having a very chronic illness where their nutrition is impaired maybe might need supplements. Some people on some medications that might drain certain enzymes or affect certain enzymes maybe might need supplements. That's all. The rest of us is fine. Having said that, Iki, I'm always honest. There are some people who have looked hard at the vitamin D data and suggest that might be one area we should look at. So I suggest you go and look hard at the data. There's been no international consensus on this, but some people think that's one area you should look at. The vitamin C one, sorry, that one has been very poor, but the vitamin D one, still some data available there.
Yeah, totally agree. I always give the traffic light colored vegetables, the
yes,
red, the
correct.
yellow, the green. You get any one of that, you get all the necessary vitamins that you need from there, really. Is it necessary to religiously clean all our groceries and deliveries before we bring them into the house?
No, my wife and I don't do that. Surface contact has not become the most important. Your risk when you go to supermarket is the people you're meeting. That's the highest risk. So, wear a really good mask, double mask if you can. I wear a face shield. My wife does the grocery doing, I do the tapao food. So we broke up our responsibilities. So we still dress the same way. When my wife comes back, first thing she does is change those items and wash them. Then second thing she does is wash her face, which is the most important thing. She changes her clothes. And then the groceries she leaves at the back. And after that, she gets rid of the packaging. But she doesn't do anything more from that. Some people, of course, I think have been washing and spraying the vegetables. I think we've stopped doing that for a long time. Yes.
Yeah.
But if you got a can and you want to wipe your can with alcohol wipe, that's fine. I think that's okay, But don't allow alcohol wipe vegetables, I think. or meat or stuff like that.
Yeah. I think for me, personally, the things that I do wipe quite regularly is the things that are very high traffic with my hands. So if my own things like the steering wheel of the car, the handbags, the purse, things that you take out and often and you can be so less mindful about where your hands are. We don't, so maybe those are some of the things that we can think of.
And Nikki, I've also invested in a UVC cleaner for my handphone. Because it's a hard thing to clean. A reliable UVC cleaner where I can just pop it in very safe, and it takes 15 minutes to do the job. Okay,
Yeah.
So that's another place we should think about. Yes.
Maybe that's one of the things that for us breastfeeding mothers, that we have the UV sterilizer that we can use it for. But make sure that you're not using it to clean your bottles at the same time. So for us who are done with the breastfeeding journey, and we still have it locked off somewhere in the house, and we can take it out for that purpose. One option, I suppose. How can we keep positive mental health during the MCO, especially for kids who are really active? They thrive outside. Yeah.
Again, depends on your situation and your geography and your location. My wife and I, we're in Ipoh. We prefer living here because it's less residential and less busy and less high rise than KL. So, what I would say for us, we may have become fitter actually because of COVID, because every day we spend 30 minutes. We live on a dead end road, so the air, there is clean because nobody comes up our dead end road, and our rest of our neighbors are largely asleep. It's very early in the morning. We're up and about, by 6:15, 6:20, we're out and jogging and up and down, get very fit actually. If you do that every day, 3 kilometers, so we're doing that. On weekends, we cycle. The moment we were allowed to cycle, we cycle. Of course, we cycle with a mask and a face shield because we're still concerned about, we meet people who are jogging and other things when they're passing by. So a lot depends on geography. If you're in a high-rise building, it's a bit tricky. I work with the management to have time slots where people can come down to jog. But again, you're going to go through a lift air space or, the staircase air space. So you're going to think about those kind of risks. You could, invest in a home tool that allows you to do on-the-spot exercising, Yeah. But as a parent, generate games for kids lah. Not sit down games alone. Hide and seek, cops and robbers, whatever you can think of, curry masa, anything that makes it exciting, imaginative, play games that require some movement, some laughter, some running around in the house. Yes, I think that can also be done.
Yeah. And I'd just like to add, like on Parent Tribe, we actually did like a week where we themed activities that we can do with children at home. And there are some really, really good suggestions on it, using apps and, things that make it look like, what's it, like PS5, not PS5, but the other one, the Sony, right? And then you do a lot of
PlayStation.
movements, yes. But the other one, yeah. So check it out. I can't remember it right now, but check it out if you have the time. And we've seen some of the videos of our friends and their children doing it. It really uses the energy. It's so much fun for the family as well, and it can be done indoors.
Let me take one question there that I saw. Yes. I'm just scrolling through a chat group to see what is maybe important to say. And someone says, I'm 23 weeks pregnant. And concerned about vaccination. Data seemed centered about immediate issues, no long-term data. Yeah, I agree with you fully in that statement. We do not know long-term outcomes of the vaccine. But having said that, most vaccine side effects, nasty long-term ones, actually do appear within the first month or two. That's been experienced with vaccines for generations, So there is no evidence right now that we're going to get long-term damage from any of these vaccines, especially the one that circulates in chat groups quite a bit about changing your DNA and affecting your unborn child and all that. US is the one that I look at quite a bit because they keep very good data on pregnancy-related outcomes. They want to produce the first data, I think. The company, of course, cannot tell you because they did not vaccinate pregnant women in the trials. Okay, but the US does keep data, and I will keep watching that data. Right now, the vaccines appear to be safe in pregnancy. That much I can say.
There's also another question asking: does the vaccination would the vaccination interfere with the other childhood vaccinations?
Yeah, any vaccine you want to give, you should give together or apart. You cannot give one after the other. I look at the MOH guidelines and it said 2 weeks. If you're an influenza vaccine today, you wait 2 weeks before getting it. I would recommend actually 4 weeks. As pediatrician, usually we're using the 4-week rule. Okay, if you had a vaccine today and then you forgot some vaccines, you're going to come back 1 or 2 days, we say, hey, hang on, the first vaccine is working, we'll wait 4 weeks. the thinking about all this is actually not terribly good. I tried to find the evidence for this many times in my life. Basically, it works. This evidence actually is about live vaccines. When you give a live vaccine, like let's say measles, mumps, rubella, which are live virus, the virus starts to replicate soon as after you give it, and then if you give another vaccine within, let's say, within a week or so, that replication of that virus may damage the second vaccine's efficacy or second vaccine's working, right? Which is why they suggested 4 weeks for let the virus settle and then give it. 2 weeks may also be maybe acceptable. So right now, I would say for these vaccines, they're all not live vaccines; they're kill vaccines, a lot safer to use. So, give the vaccine either at the same time in different arms, of course, or give them one after the other. Minimum duration, Ministry of Health says, is 2 weeks. If you want to be safer, 4 weeks is a good period of time. Okay, which is why you see our vaccine schedule is all 4 weeks for our children. We give 4 weeks break between every vaccine schedule because it is a very old standing rule about spacing between vaccinations.
Yeah, yeah. A parent asked, and this is a practical question with regards to the antigen test. Would vaccinated people appear positive on the antigen test? I think this is to help them understand how it works and
no, the antigen test is not going to be influenced by your vaccine, by your vaccination at all in any way. There's an antibody test though, that will be of course affected, and some people are using it to test to see whether they responded. I don't know whether you want to waste that money or not, but maybe some healthcare professionals feel more comforted because they are high-risk individuals. I have one question there which says, will the vaccine have a negative effect on our teen reproductive system? Not seeing any data for that. Seen data on the converse side for adults, no effect on fertility at all. So I don't expect any of this happening to our children. Okay.
Yeah. There's a question after that says about mixing of vaccine. That I think there's studies currently doing that. They're exciting to see the data that's coming out from that. What are your thoughts, Amar?
I want data. I think it's beginning to show, that using one after the other, especially for some of the vaccines, produces even better immune response. But we don't have enough data on side effects. The immune response data is appearing. The side effect data, I don't think we have enough. Right? So let's wait a little bit. I'm sure it's going to become part of the system, especially from Europe, where those who offered the first dose AstraZeneca were younger, will then offer the Pfizer as the second dose. So a lot of good data is going to come out there. Yeah. There's one question higher up about which pulse oximeter brand to buy, and there'll be asked questions about which best mask to buy, and so on. Have a look at one of the documents I circulated about getting ready. Inside there, I put 4. I did put down 4 brands of pulse oximeter because that's the brands in the doctors group online that we think are the better ones. Some of them have FDA approval as well, and buy them. Most of them cost between about 70 to about 200 Malaysian ringgit. That's about the cost of them. Of course, you can buy a much better quality one for $2,000-3,000, but I don't think you need to do so. In terms of masks, I'm going to say something here. Buy a good quality 3-ply mask. Okay. There is a local company. I'm not advertising. I have no shares, but there's a company called Durio, Durio, which actually does melt-blown masks, which are 4-ply, which are quite hard. They also sell 3-ply. They also sell N95 masks. These are meant for the public, actually, the N95, because they got loop. The doctors prefer tying, which gives them a better fit. But I have bought the Durio N95 to try. My wife and I have tried them out, and it's actually a very good fit. You can't breathe for very long, though. But it's the kind of mask you want to use, that Durio N95, when you're going to do your vaccination. You want better security. You don't need the double mask at the time because you got a good mask. Or if you're going for a high-risk thing, maybe you need to go shopping urgently for something, that's maybe the mask to use at that time. Otherwise, the Durio 4-ply masks are pretty good. Again, remember what we were saying, that the mask leaks, the 3-ply mask. So wear a cloth mask on top is a good idea. There are better masks than that, but I don't want to share here because I think I always worry about people's financial abilities are different. Okay.
Yeah, and like how Amar said, like the fit is really important as well. So sometimes I feel like for for people who have smaller face than me, even like the normal standard size mask is there's a lot of leakage, and so if you're not able to agree, or like you can't breathe very well with the higher ply mask or the N95 or N94, what you can do is actually tie a knot very close to the one, and that actually effectively improves the fit on a smaller face frame like mine. In fact, I felt it was so much more breathable. I do know it leaks less because I don't get any more fogging on my spectacles. So that's another method of wearing a mask effectively as well.
I put a diagram for that and a link inside one of the documents I wrote about getting ready. That getting ready document talks about how to handle the current pandemic and the key measures we should take to make ourselves safer. There's a diagram and a link to the CDC site and a video how to do that tying better.
Yeah. Okay. All right. I think there was a question earlier that says about the risk of going to huge PPV vaccination centers, whether that's like a huge risk of contracting COVID. Yeah, but I think it's a necessity that we go to a vaccine center, and we can't choose our vaccine centers right now, can we? And we still need to get vaccinated, but we certainly can put into place all the protective measures that we have to reduce our risk to the minimum if possible.
Yeah, that's the time you want to wear the best mask. That's the time if you have an N95 mask, wear it. That's the time to go. And why do I wear a face shield? I don't just wear eye goggles. I wear a face shield because the face shield not just covers my eyes where the virus can go in, but it also covers my mask. So the viral particle hitting the surface of my mask is less. Okay, the shield without a mask is useless, but the shield with the mask, there's some data suggesting that it improves your benefit.
So
and consider anything, at that time.
Yeah, it can also help us from unknowingly
yes. Yes, correct. I see lots of people doing that, and I even see people in the health who are online doing press conferences touching their mask half the time. Oh, that's very dangerous activity. Your surface of your mask is the dirtiest, most risky place to touch.
Yes.
I saw one question there saying that, our schools only sanitize once a day. This benefit is school in morning, afternoon session. Now, the single most important place to sanitize, if you have a morning and afternoon school, different children are coming to the same classroom, is the desktop. Not the desktop computer, but the tabletop of the child. So I would recommend that we train our children. We give them, alcohol spray, 75% alcohol spray, or we give them an alcohol wipe, which are also available. Okay, and then they wipe, or if they spray, then they wipe it, and then they trash that, and then they clean their hands with alcohol gel after that, or alcohol to that. That's the minimum I would do. But I would think if I was a school, I have a 1 hour break between the two. I get my cleaners to go and clean all the tables. I get my cleaners to go and clean all the handrails, all the places somebody may have walked. Try walking upstairs these days without touching the handrails also is something that we need to learn to do, unless you think you're going to fall, okay? Having said that, even if my child go to school where they're good in doing this, I will still tell my child, you clean your tabletop, and if necessary, you clean your chair also. And just wipe it down a little bit. Those are the places that I think the highest risk. The other place that's high risk is a toilet, and that is the place that don't know what to do about. How many times we're going to clean the toilet tap? Huh? If we can, if we got enough money as parents, put in elbow taps. Something that they can close easier. Don't have to go and do that kind of thing with it. But don't take off your mask in the toilet. Clean your hands once you come out of the toilet.
Yeah, wonderful. Okay, so we've run out of time. Okay, Amar, if we can just touch on the last two, and then we'll stop over there.
Sure.
Parent clarifying that she's fully vaccinated, but the blood RTK, antigen test, but the test was positive, but confirmed not COVID later on, presumably by PCR. So that's a case of just a false positive.
It's possible, or it could be that, it depends how quickly they did the PCR after the RTK. It could be that your viral particles are dropping. Unlikely though, because the PCR is a lot more sensitive than the RTK. So it could be a false positive, and that is a reality as well. And the next question, Iki, that you're putting, you think there is, do you have to keep changing the face shield after use? Yes, of course. You wash it. Face shields all come in a plastic format, so we just wash it with soap and water. Washing with soap and water is fine. That will kill the bug. My wife usually soaks it in a small tub of soapy water, and then after that she washes it, and that will do the job nicely.
Yeah.
And then air dry it.
Yeah. I just want to add that even though we're vaccinated, we must remember that we're not 100% protected, and so we still can contract the illness. There is a possibility of that. But of course, we know and we trust that the vaccination actually, number one, protects us to reduce the risk of that. And even if we do contract it, it helps us to not get the life, what do you call this? The complications of a severe COVID infection. That's what we want to protect ourselves
and that
against.
data is good for Pfizer and AstraZeneca right now, that you may get infected, but the majority do not get hospitalized or die. So that's why the problem now is that those who are vaccinated, help to reduce the spread, but when your community is not adequately vaccinated, it spreads to the unvaccinated.
Wow. Okay. Amar, we've come to the end of the Q&A. Thank you so much. Let's take a deep breath.
Yeah. Amar can always go on. He's got Energizer battery, isn't it? Huh?
Yes.
Yeah.
Do you have any last words to say to our participants?
Yeah, I want to say that, don't waste a moment with your children. Say you love them. I think this applies to everybody around us. Tell people many times, not just once a week. Tell them every day. Tell them a number of times a day, I love you. Tell them in many creative, different ways. Huh? COVID has showed us how transient and difficult our lives can be. And I know a lot of friends who have lost their loved ones. I know people whose families have been decimated by COVID right now. Don't waste the opportunity to tell someone you love them. And our children need to hear that. They need to hear the security of our love. Just as much as we want to receive the unconditional love of God for ourselves, we also need to extend and leak that love out to children and to others around us. So tell people you love them. Don't fail to do so. Call up your grandparents, FaceTime them, get children to talk to grandparents on their video chat or whatever mechanism and say, I love you. And say that often. Don't be shy about it. Don't say, I come from a Chinese background or whatever. We don't say this. No. Now is the time to express your feelings to each other and show your appreciation of each other. Okay.
Thank you, Amar. That triggered something. I haven't called my pawpaw. I think I'm going to do that with my kids later.
Okay.
Wow. Okay. So, guys, it's been a really informative morning. I mean, we've looked at how the COVID situation has evolved, how it's impacted our families and our children, the factors to consider when looking at COVID vaccination for our children, as well as the practical issues that we can tackle as we prepare our children to eventually go back to school and to go back to school safely. So thanks, Amar, for bringing all of these insights this morning. Before we end, I just like to let everybody know that, again, that this event is recorded and it will be put back onto Facebook after a time. And for everyone who has registered, you will be getting all the juicy information-packed notes by Amar after this. Give us a bit of time, Kay, so that we can collect, and then after that we can send it to you all. And for those of you who have not registered, registration closed already. But if you got friend in here, right, then you ask each other for it. Okay. I just like to let everyone know of an upcoming online event. It's a really special program by the Focus on the Family for the community, and it's called Let's Talk About Sex. Yeah. Is it getting very, very sour in your mouth right now? I remember the last event run by Focus on the Family. We discussed how the family, the home, should be the first point of reference for sex education in our children, and that we need to create an atmosphere at home where parent and children can build the trust together and to be comfortable to talk about such intimate matters. They shouldn't be turning to the outside as the first point of reference for matters like this. It should be in the family. It should be us in the family. So what's amazing about this program is that it's not curated just for parents. It's not curated just for the child, but it's actually for both parent and child. And this is targeted for children aged 10 to 12 years old to create a safe space for each other to learn to communicate as openly as possible about the area of sex. It will be run by this good-looking guy here. His name is Joshua Leong from Focus on the Family. He is an international speaker and trainer who speaks on issues about youth, sexuality, parenting, and marriage. He is also a senior master trainer for No Apologies, which is a global character-based curriculum developed by Focus on the Family USA. So do follow and be a part of the Parent Tribe community on Facebook as well as Instagram so that you can get the notifications on this event as well as all the other exciting events that are in the pipeline for the rest of the year, because I think probably we're still going to be stuck home, you know. So once again, thank you, Amar, for spending your precious Tuesday morning with us. Yeah.
Vicky,
Amar
can I
wants to
say
say something. Yes.
Yeah, there is going to be, I think Tiffany is going to share also a questionnaire in the pack that she sent you. This is done by Buddy Bear, which is a helpline. I think the organization behind is Humankind. They're good people, and I support them as well. They're trying to create a helpline which is useful for children to reach out when they are in distress. So I think that questionnaire also may come out with the pack when you see it. And I would encourage parents, if you could help Buddy Bear, I'd be grateful. Thank you. Back to you.
Yeah, that's great as well. And you can also find them on Instagram. They're active on Instagram as well as Facebook. So thank you everyone again for joining us. Stay safe and have a wonderful week ahead. Bye.
Bye everyone.